Welcome back. Today we'll be looking at a very important topic in anatomy, which is the brachial plexus. And in this video, I will focus on essay writing and what to do, how to form outline when you are asked to write on the anatomy of the brachial plexus. Here is a question that says, describe the formation, relations, and distribution of the brachial plexus. Add a note on its applied anatomy. The applied anatomy here is talking about the clinical application of the brachial plexus. Now, this is a mnemonic that I formed that can help you form outline of when you are asked to write on any structure, which I call the transit structure. These transit structures are structures that are moving from one point of the body and they terminate at another point of the body. So with this, you can form an outline for transit structures. As you go through my videos, you will see me applying this mnemonic for other transit structures in the body. Today, we'll be using this mnemonic for the brachial plexus because the brachial plexus is a transit structure. It has an origin and it terminated at some point. Now, this mnemonic is I only carry strong books regularly, calmly. I only carry strong books regularly, calmly. I for introduction, O for origin, C for cause, S for structure, B for branches, R for relation, and C for clinical correlation and conclusion. As introduction, the brachial plexus is a network of nerves that supplies motor and sensory innervation to the upper limb. Now, the brachial plexus originates from the ventral rami of C5, C6, C7, C8, and T1 spinal nerves. The course of the brachial plexus is as follows. The brachial plexus passes between the anterior and the middle scalene muscles in the neck. It travels under the clavicle and over the first rib into the axilla. It then surrounds the axillary artery and continues down as terminal branches, as terminal nerves. So the brachial plexus forms terminal nerves that continues down the arm. So I want to know that the brachial plexus travels under the clavicle and over the first rib. And with this interesting mnemonic, brachial plexus take cover over first can help you know that the brachial plexus travels under the clavicle and over the first rib. This can help you know the cause of the brachial plexus. The mnemonic is brachial plexus take cover over first. The next is structure. Whenever you're asked to write an essay in any topic in anatomy, always remember to draw and label the diagram of that structure asked in that question. So it will give you 3 marks in your exam. Whenever you're giving essays to write on any structure in anatomy, always remember to draw and label that structure. It will give you 3 points in your exam. Now the next are the branches. Now the brachial plexus is a special plexus because it has an order, and the order is the root, the trunk, the division, the cord, and the branches. And with this mnemonic, Real Madrid teams during cold beer, you can remember this order of brachial plexus because with this order, there are some branches from different parts of the brachial plexus. Now, R in Real Madrid for roots, C in teams for trunk, D in drink for division, C in code for cord, B in branches for B in bears for branches. Now, I want to know that the cord is divided into a lateral cord, a posterior cord, and the medial cord. And the division. We also have the anterior division and the posterior division. This will help you understand some concept as we progress in this video. Now, this is a picture showing the different parts of the brachial plexus, which is the roots, the trunk, the division, the cord, and the branches. And we have Real Madrid teams during cold beers. Real Madrid teams during cold beers. These branches represent the terminal branches of the brachial plexus. Now the next is a mnemonic that will help us know the the branches of the roots and the trunk. And this mnemonic is don't lose some sharp skills. Don't lose some sharp skills. D for dorsoscapular nerve, which is a branch of the roots. L for long thoracic nerve, which is a branch of the roots. S for supraclavicular nerve, which is a branch of the trunk. The second S for subclavicular nerve, which subclavian. The second S is subclavian nerve, which is a branch of the trunk. Now the first two letters form the branches of the root, while the last two letters form the branches of the trunk. Also take note of the nerve root, the root where it is coming from, because it can be asked in your multiple choice questions. Now, from the trunk has equal roots C5 and C6, while the long thoracic comes from C5, C6, and C7. Now, this is from here you can see this is the root of the brachial plexus, and we have the dorsoscapular nerve, which is a branch of this root, and a long thoracic nerve, which is a branch of the root. This is the trunk of the brachial plexus, and we have the supraclavicular nerve, which is a branch of the trunk, and the nerve to the subclavius, which is also a branch of the trunk. The next is a mnemonic that can help you remember the medial chord of the brachial plexus. I told you initially that the chord is divided into three: the medial, the posterior, and the lateral. So the medial chord of the brachial plexus can be remembered with this mnemonic. Most medical men use morphine. The first M for medial pectoral nerve, the second M for medial cutaneous nerve of the arm, the third M for medial cutaneous nerve of the forearm, U for ulnar nerve, and the last M for medial root of the median nerve. This is the medial part of the chord. Here we have the medial pectoral nerve, we have the medial branch, medial cutaneous nerve of the arm, we have the medial cutaneous nerve of the forearm, we have the ulnar nerve, and we have the medial branch of the median nerve. All these are branches of the medial chord of the brachial plexus. The next is a mnemonic that can help you remember the lateral chord of the brachial plexus, and this mnemonic is Love Lucy More. L for lateral pectoral nerve, the second L for lateral root of median nerve, and finally the M for musculoskeletal nerve. So this is the lateral chord of the brachial plexus. We can see the lateral pectoral nerve here. We can see the musculoskeletal nerve here. And finally, we can also see the lateral branch of the medial nerve, which combines with the medial branch of the medial nerve, which is a branch of the medial cord to form the medial nerve. Now, finally, we have the posterior cord, the branch of the posterior cord, and we can use this mnemonic ultra to know the branch of the posterior cord. U for upper subclavicular nerve, L for lower subclavicular nerve, T for thoracodorsal nerve, R for radial nerve, and finally A for axillary nerve. So here the posterior cord of the brachial plexus. We can see that we have the upper subscapular nerve, we have the lower subscapular nerve, we have the axillary nerve, we have the radial nerve, and we have the nerve to the latissimus dorsi. All these are branches of the posterior cord of the brachial plexus. Finally, in this mnemonic, we have the clinical correlation and the conclusion. From our question, they asked us to write notes on applied anatomy. The applied anatomy here means the clinical correlation. And the clinical correlation I want you to know about the brachial plexus are as follows. 1. The brachial plexus injury. Brachial plexus injury can occur during birth, forming Erb's palsy or Klumpke palsy. And these are due to trauma during birth. The next is nerve compression. In thoracic outlet syndrome, the brachial plexus nerve can be compressed causing pain and weakness. The next is surgical relevance. Understanding the brachial plexus is critical in nerve repair and retinal anesthetic, that's brachial plexus block. So all these are the clinical correlation or applied anatomy of the brachial plexus. The next is conclusion. So the brachial plexus is a vital structure of the upper limb. It complex branches ensured ensures coordinated movement and sensation. So I want to tell you that whenever you're writing conclusion on anatomy, you don't need to cram, you don't need to memorize anything, you don't need to do anything special. If you can remember one of the function of the organ or the structure you have talked about, that can form your conclusion. So you don't need a special thing to do when you are asked to write conclusion on any topic in anatomy. Now, we have gone through this topic, and this mnemonic have helped us in forming an outline and giving us a basis on how to tackle brachial plexus when if it is asked as an essay question. If this mnemonic and other mnemonics in this video have helped you and you are confident that you can write an essay on the brachial plexus, please, I want you to like this video, I want you to share, I want you to subscribe. I also want you to click the notification bell so that you get notified when I post content that will help you do very well in medical school. Thank you for watching.